Good morning, everybody. Thanks for joining us on the podcast. We're just having a little bit of technical difficulties, so we're trying to smooth those out before we get started. I just wanted to say hello and good morning, and we'll be with you in just a few short moments. Appreciate your patience. Does anyone want to talk about what's going on this week? What's gone on and what's going on soon? I know we had a good event yesterday. Thelma or Claudia, do you want to talk a little bit about that? How it went and everything?
Good morning, everybody. This is Claudia. We had women's wellness. I'm looking for the flyer. Yesterday at the senior center, first we began with the walk at 9 a.m. And then we had the presentation by Troy Campbell on mental health. And then we had a lunch.
Well, she's coming through on the podcast. She's not coming through to our headphones. So
that's why, because we're not connected.
Oh, okay.
Can't hear me? Can you hear me?
I can hear you now.
Okay. So we had a good turnout, and everybody enjoyed the taco bar that we provided for the individuals that came for the women's health presentation. So it was great to see everybody and to congregate again. So we had an enjoyable day. Thank you.
Awesome. Looks like we have a couple of people with us. So we just want to, today we want to talk a little bit about COVID-related items as far as treatments available, just to keep everyone up to date on everything COVID. And so just waiting for computers to cooperate. We'll be talking about like some of the medications, but also some of the stuff that's available in Mexico. But we also want to discuss some of the other therapies that are available. We want to encourage people to still, maintain a sense of vigilance around hand hygiene and keeping our homes disinfected to a level. Wearing masks in crowds, I'm still doing that, and I hope everyone's considering that as well. There are other things going around, just, the common cold and other minor viruses that can be pretty unpleasant, that we still want to protect each other from. But yeah, I mean, in other news, it sounds like as far as our outdoors go, I think the fire up in, is it called over in Los Alamos? What's the fire over there? Looks like they think it's pretty much contained. I think that was as of Tuesday. So we shouldn't have too many more smoky afternoons. So our air quality will hopefully improve from here. Seasonal allergies are obviously going to be another thing that's going to make you wonder, is it COVID or is it allergies? I deal with that all the time. So we're still offering testing. It's really important that if you feel like you need to be tested, if you have symptoms, if you've come in contact with somebody that you know that we're still here, we still have tests. We want to make sure that you know that service is available to you. We still have masks. So if you need masks for anything, definitely let us know. Call the COVID hotline. Reach out to us and we can get you some of those as well. So, it's COVID is still out there. Obviously, the numbers here and in general are low. Here, they're non-existent, I think. Do we have one case or none? We're at 0, so that's very good. Just got to keep up the good work and stay protected till maybe we get a shift in this and figure out what the future holds. So I applaud everyone for that. I know everyone's worked really hard at protecting themselves and others, really bound together as a community to make an effort to do the things that we need to do to avoid getting sick. So that's really great.
Questions?
Do we have any questions? Claudia, you want to say something?
Okay, I just wanted to remind the community that we're still walking on Tuesdays and Thursdays at 9 a.m. at the softball and baseball field. So come out and join us. Feels good to walk.
Yeah, it's such a nice area to walk into. So
I know it's
a good
getting a
chance.
little hot now, but
Are we going to move that up eventually? Do you know if we decided on
thinking about it, but
Yeah.
I haven't heard the specific time. So
Okay. Yeah, if we decide to make it earlier, folks, we'll definitely let you know ahead of time so that because of the heat and the sun, we don't want to send anybody back to work after their break with in dire need of a lot of water. We want you to drink water, and we definitely want you to come walk with us. I try to make it out there when I can, and it's very good for all levels of activity. So I think that's really cool that we do that. What else is going on?
Becca?
Yes.
Welcome. I just want to remind everybody that we are still giving out the $60 gift card for those who have been vaccinated. That would mean that you would have to have your first, second, and third vaccine. And you can send us a picture or bring it by our office and show us that you have 3 of your vaccines so we could go ahead and give you your $60 gift card. Just a reminder as well that the deadline is the end of this month. So if you haven't received your third vaccine, I'd like to encourage people to please go and get your third vaccine, and you can receive it after the end of this month. You will not receive it anymore after that. So just please try to encourage your family members to please get it. You can schedule an appointment at Santa Clara Health Clinic, or you can go ahead and schedule it at the Santa Fe Indian Hospital. We did have one, the state come in on the 14th of this month. I believe that that was the date, and they were giving out all the vaccines that anybody needed. It was Pfizer though. Some people did switch. They had Moderna, so they did get Pfizer. So both works if you want to mix, but just letting you know to encourage anybody who haven't received it to please get your vaccine. Good done.
Thanks, Selma. That's really important. Definitely need to get those boosters, need to get your vaccines. It's okay to mix. It's safe. In some science, they prefer it, and others, um, either way, getting a booster is really important to keep your immunity up. I know folks that might, question that with breakthrough cases, but remember that the vaccine doesn't necessarily completely prevent 100% you from getting COVID. It's also makes it if you get COVID, you don't get direly ill in general. So everyone's a little different, but overall, that's the main goals. We want to keep folks out of the hospitals. We want to try to do whatever we can to prevent you from having severe and life-threatening symptoms, and also hopefully make your recovery from COVID better as well. Because long COVID is a very real thing. We want to let folks know if you've had COVID and you think you may be experiencing symptoms of long COVID, we're here to talk to you about that. We can help you get some learning resources to figure out some of the things you can do to help slowly increase your levels of activity if you're having shortness of breath or fatigue. I know there are some folks that have long COVID and they need to go essentially through a PT or rehab program. So it's a serious thing, and we can do things to help you figure out that path. So get your shots, definitely, Claudia.
I just wanted to remind the community too that I'm still taking applications for the New Mexico Farmers Market program, and I think the cutoff date is June 1st of 2022. And so that's also a $50 that they receive through the state. And it's from age 55 and older for the Native American population. And then there is some income guidelines. You have to be 185% under the federal poverty guidelines. So that's just some more information. And you can contact me at 455-4115 for an application, or I can take it by, or you can come get one here. Thank you.
Awesome. Thanks, Claudia. It looks like our fearless leader has joined us. He's going to talk to us a bit more in depth about the COVID update.
Good morning, everybody. Oh, that's loud.
It's because we're now on the thing.
How about that? Okay. Good morning, everybody. Thank you for tuning in, for those who tuned in, and for those who watch this later on, for holding off for the last several minutes while we try to get set up here. I wanted to comment a little bit on what was talked about earlier about the women's health event that happened yesterday before we get started, because I really wanted to thank all the community members that came out and took the time out of their busy day to listen to information that's extremely important around mental health, and during Women's Health Week, National Women's Health Week, as well as Mental Health Awareness Month, which month May is. And we had quite a good turnout, and people actually came in and sat down and listened to that good information. And we are going to have a second presentation for this for the men in the community in June, on June 14th at 5:30. It's going to be a Tuesday evening. So we invite all the men in the community to join us to have more of a conversation about mental health, because we have to not only change the conversation around mental health, but start the conversation for those who have never had an opportunity to have those discussions. You'll be able to come in there and be yourself and ask questions about a topic that is rarely brought up, especially in the the male side of the population. So I don't want to get too much into that right now, but I just wanted to, make sure we mention that and make sure everybody knows it's coming up, because there were a lot of folks who said they weren't aware of the event yesterday. But I do want to make sure that anybody who is male in the community that's over the age of 12 and older, they are welcome to show up and come and have a conversation with us about this important topic. So that's really what I wanted to talk about and comment on from the conversation from earlier. So with that being said, we're going to go ahead and finish going through the update for COVID first, and then have whatever conversations we need to have about other health and human services topics that may need to be discussed. Rebecca talked a little bit earlier about our current status for COVID in the community, and as of today, like she said, there are 0 cases, none active as of right now. Um, there have been 224 cases total and 222 recoveries. Um, one of the things that we have to be clear about, though, is that as we continue to move forward with no cases and or low cases, we are getting to the point in the public health community where we're embracing the fact that COVID is never going to go away. It's going to be here, for the unforeseeable future. So we may not have any active cases now or an outbreak now, but it will be something that we have to live with for, who knows how long. So we have to keep looking at this as um, something that we need to stay on top of, because we tend to forget once we've been gone some days um, without cases, and that sometimes creates a problem for us, because when we get complacent is when we usually end up um, having mistakes and not being prepared for issues around certain things as they come up. And COVID is one of those things that we have to pay attention to, because as we've seen over the past 2 years, it keeps coming back and back and back, which is was expected, because it is a really new virus, and we really are still trying to learn what it looks like and what it's going to look like in the future. But we have to make sure we pay attention to that. um, Wanted to share um the screen here uh, just to show the cases, the current case jump over the last 2 weeks across the country. Now, this is a news article, but it's linked to an active monitoring system that shows the cases in the country and where they have been over the past 2 weeks. And if you notice, the scale on the top it shows basically the gold is showing decreasing, and which is only one state in the entire country that's showing decreasing cases, and then all the rest of them are increasing at a specific level. Um, that's the batch of states that have some increases, and then we're right in the middle with the majority of other states. So we are seeing some increases of cases in the state of New Mexico. It is important to recognize that um, case counts aren't always the determining factor of how serious our current issues are with COVID. But I wanted to make sure we pointed that out, because it is important to know that the majority of the country is still showing quite a bit of increase in COVID cases. So we have to keep in mind that you know we're not out of the woods yet. But we will, keep monitoring it as a COVID response team and make sure that we um, give the right amount of support to the community just in case we do have some sort of an outbreak in the future. Um, going to dashboard next for the state of New Mexico to give an idea of what it looks like specifically in the state and in the county. So for the state of New Mexico, as you can see, it's still somewhat it's clearing up quite a bit. You have a large part of the state that still shows that there are still cases here, but as you can see, there's only a few cases at this point that um, or at least a few counties that are actually considered low transmission with fewer cases. Close to us up here up north, but here we are, Santa Fe County, and you notice in Santa Fe County we're still averaging, 28 cases per 100,000, which is not low, but it's not high. But being that it's red, it's showing that there's still high community transmission. But I wanted to make sure we understood that numbers of cases aren't what's most important. What's most important is, most of the time is what the hospital rates are. Currently, we have, it doesn't even show here what the current hospitalization is.
85 in the state.
That's
Yeah.
total. Yeah. Total 85 cases in the state of New Mexico right now, which is low. But hospitalization, if you got to that point where you're hospitalized, that means there are some challenges that you're dealing with. So we want to make sure that we pay attention to those numbers, hospitalizations and current death rate, because that is a true um, uh, representation of where we are with regard to COVID. So with that being said, what's driving the COVID cases in the United States and the state of New Mexico are the current variants of concern that we're dealing with. And these are all Omicron variants or subvariants of Omicron that we are consistently dealing with. As you can see, if you've been watching the news, the BA.212.1 is what everybody's been concerned about because it is driving the majority of the cases in the country right now. That's one of the reasons why we are having a spike. But if you look down at BA3 and BA4 and BA5, those are newer variants. However, they are being looked at as as higher transmission variants. It's not been found in the United States as of yet. They are in other countries, but as you know, all the other variants, they usually originate in South Africa or someplace in Europe, and they show up here. So I just wanted to kind of point those out. And if we are being honest, people are still going to get sick. People are still going to have problems with COVID, whether you're vaccinated or not, especially those individuals who have immunocompromising conditions that put them at greater risk of hospitalization. And those are the ones that I think most people are concerned about, especially talking about in the news because, um, you know, everything is opening up and people are going on about their business and people are feeling as though the immunocompromised population are being left out in the cold with regard to keeping them protected and things like that because people are no longer wearing masks and there's not a big push for vaccinations in some areas of the country, and people are starting to gather again. I understand that, over the Mother's Day weekend, I believe that there was another local tribal community that had some activities, and from those activities, there's been a little bit of an outbreak. So because those cases can directly overlap with the Sinai community because of the connection between the people. We also have to understand that sometimes when those outbreaks happen someplace else, they could show up over here. So for those who are immunocompromised, they are always concerned about, well, what about us? What about those of us who are really concerned about our current status and things like that? And I just wanted to, the fear around being immunocompromised is something that is scaring a lot of people. So we wanted to talk a little bit about treatments that are available. Um, there are um, quite a few treatments that are available to everyone with regard to COVID. I think that right now, of all the respiratory illnesses that exist in this world, COVID-19 has the most treatment options for the disease that we're dealing with currently. So I wanted to point that out because there are quite a few treatments that are available for COVID. And what treatments are designed to do, just like, um, you know, the vaccines have their purpose, the treatments have their purpose. So the purpose of the treatments for COVID-19 are to keep COVID-19 symptoms from getting worse, to reduce the need to be placed on a ventilator, to help with breathing, to avoid a hospital stay. And this is one of the reasons why the country is opening up a little bit better and a little bit more. That's because, in the beginning of the COVID-19 pandemic, there weren't any treatments or vaccinations for COVID. So that's why we saw a large number of deaths and hospitalizations and people getting really, really sick from COVID because there was no way to treat them. And now we have tons of way to treat them. And we're going to go through those here right now. But I wanted to make sure the immunocompromised folks understand that there are quite a few treatment options for everyone. So this one right here, the Evishield, is a monoclonal antibody that is different from the rest of them because it's not designed to treat COVID-19 when you get it. It's actually designed to prevent COVID-19. Basically, it's a prophylaxis. So just like the vaccine is designed to keep you from getting sick and ending up in the hospital from COVID-19, this new treatment option, yes, it's approved for emergency use, but it's for those people who are immunocompromised where the vaccines are not working the way that we would like them to. Basically, its design is to provide those that are immunocompromised another option to help them to be protected against illness or hospitalization because the vaccines are not providing enough of an immune boost to give those immunocompromised people options or protection. So the eligibility, you have to be 12 and older, weighing at least 88 pounds. You don't currently have COVID. You have a moderate to severe immune compromised condition due to a medical condition, or you've gotten a vaccine, and when they've done your immunity, they tested you for what your antibodies are, your immunities are. You basically had no response. You didn't have any sort of um, or an adequate amount of antibody response to the vaccine. So this Evishield is designed to give that protection for those individuals who don't have an adequate response to the vaccines. So those people that we're referring to are, that long list of moderate to severe immune compromised conditions. And there are quite a few, obviously, but the ones that I think are most important to look at, we have a lot of individuals in the community who are dealing with kidney issues, especially renal insufficiency, stage 4, stage 3 chronic kidney disease as a result of their high blood pressure or their other medical diabetes that have caused some damage to the kidneys. Those individuals are definitely on the list that could qualify for the Evishield prophylaxis treatment. Um, and we also have individuals in the community that are over the age at or older than age 65 that are not responsive to an antibody assay. So basically, when they get their vaccination, they're not having an adequate response. But what's important here is this other qualification is important. Two or more impairments of assisted daily living. So activities of daily living, if you have some impairments and you're over the age of 65, so you can't cook or clean or care for yourself in a way that would be uh, best to keep you safe and healthy, that is something that you really need to look at because one of the reasons why that is because it puts you at risk of being of illness. So um, this, if you meet any of these criteria as moderately or severely immune compromised, you can contact your doctor and ask for this monoclonal antibody before you get COVID, not wait until way after until you're already getting COVID. Because if that's the case, then you have to worry about these other medications. So these lists of monoclonal antibodies or treatment options are designed for those individuals who are currently hospitalized. We hope that nobody really ever gets there, but these are ones that are available out there. So the convalescent plasma is something that's available in New Mexico. The remdesivir is also available in New Mexico. The other ones can be ordered, but if you're already at the point where you're pretty far gone with regard to the vaccine is causing a lot of damage to your body. Let's just hope we don't ever need those, but these are treatments that are available for those who are in hospital. For those that are not in the hospital, there are these other treatments, the ones that the people keep hearing about now because it's really inexpensive in comparison to the other ones because you don't have to go in for an infusion. Is the Paxlovid, which is a pill that you take, which must be given within 5 days of your treatment, or sorry, of your symptoms appearing. So if you're at high risk of developing um, severe illness or being hospitalized as a result of a medical condition or a poor response to the vaccines. This is something that they're giving individuals who are testing positive for COVID. One thing is that if you are on that list of individuals who have kidney disease or liver disease, this is not something that can be used for you. So the easy method, the pill method that a lot of people are getting once they test positive for COVID and have mild to moderate symptoms, um, they're getting that medication. But if you have kidney or liver disease, it's not something that's recommended. So you have to go to one of the other versions of monoclonal antibody. And as you can see on the list, there are several others that are available that could be provided to you if you are not hospitalized and you have symptoms of COVID-19. So one of the reasons why I wanted to point this out is because a lot of folks are concerned, about getting COVID. People are, for lack of a better description, freaking out that they're vaccinated and they tested positive for COVID. We wanted to make sure we remind people that just because you're vaccinated does not mean that you're not going to get COVID. It's not very likely that you're going to get COVID, but it isn't impossible for you to get COVID because after, so basically how it works is you get your vaccination or your booster, and 14 days after you receive that, they're saying that you're protected to the level somewhere between 75 and 80% and 85% protected. So you should not actually get a symptomatic uh, you should not get symptomatic COVID. However, because it's between 75 and 85, what does that say? That means that somewhere between 15 and 25% of the time, you're going to get COVID, regardless of whether you're vaccinated or not, which is the reason why we keep on pushing that the vaccination isn't designed to stop you from getting COVID. It's designed to stop you from ending up in the hospital, on a ventilator, or dying. And so, um, But if you are one of those 15 to 25%, think back to what we were just talking about. You have all of these treatments that are available to you if you test positive and you have mild symptoms, or even if you end up hospitalized, there are quite a few medications that they have that they did not have in the beginning of the pandemic to treat COVID. These are COVID-19 specific treatments as opposed to the ones that were released early on that were designed for other viral infections or other infections that people were getting sick with, and they weren't specific to COVID. But since this, 2-year time period, the doctors and the scientists have come together and they developed really good treatments. So the likelihood of death or serious hospitalization with serious illness from COVID is very slim at this point because you have all of these treatments available to you that were not available at the beginning of the pandemic. So just wanted to point that out because a lot of folks are still freaked out and scared and worried about COVID-19 and when you get it, what should I do? Well, just remember, as soon as your symptoms pop up, which is one of the reasons why we really do promote contacting the COVID response team to let us know if you test positive, whether it's on a home test or you haven't have gone to the hospital for something, urgent care for something, and they tested you and you tested positive, contact us. Why? Because when you're in a state of crisis or fear because you've tested positive for COVID and you don't have any idea what to do next, sometimes you don't remember to call your doctor and say, hey, I need to be considered for A, B, or C treatment. What should I do? So, what the COVID response team does is they are an advocate for anybody that is a tribal member or who lives in the community as part of the community, as a community member, and we can contact your physician for you with your permission or at your request and start arranging these types of treatments for you. We've actually done this during the time of us working with individuals in the community who have had COVID. We have actually contacted their providers, and the providers got them scheduled and set up, and they either started getting the infusions for the monoclonal antibodies, or they were prescribed the prescription, the Paxlovid prescription. And guess what? Our CHRs or our community, our COVID response team drives down to the pharmacy, picks up the pill for you, and brings it to your house so you don't have to leave. Because once you test positive, what are you supposed to do? Isolate, right? So how do you get your medication? Well, we will go pick it up for you. So contacting the COVID response team is not just to, give us information about your positive test, but it's to help to advocate for you and steer you in the right direction to show you what to do if you do test positive for COVID, vaccinated or not, because we're here as a COVID response team to respond to anything COVID related. That's the reason why the name of our team is what it is. So the numbers are on the screen. 505-252-5986 is the COVID hotline number, or you can send us an email at the COVID email and let us know something if you are, uh, wanting to send us an information or whatever. You can contact us in either way. So just wanted to bring this information to all of your attention to make sure that you're aware that, even though we have zero cases, even though we are, the country is looking up, and forward with regard to COVID, what about you individuals who do get it? What about you individuals who are still concerned? As the antibodies start to reduce in your body because time goes by, because the boosters and the vaccines start to diminish in effectiveness with it between 4 and 6 months after you get the shot. Guess what? As time goes by, you're at a higher risk of um, you know of developing or catching COVID and having symptoms from COVID because your immunities are now no longer protecting you. So that's what I wanted to say about the COVID stuff. You might have seen in the news that the FDA has approved the booster shots for the 5 to 11 population. So if you have any kids that are between the ages of 5 and 11 and you're concerned about their risks of contracting COVID, definitely let us know, and we can start trying to arrange to get you set up for that. The CDC has not yet approved it or condoned it, but we do want to make sure that folks understand that generally, right after the time the FDA approves it, you're going to get they're going to announce by the CDC that they're going to agree with the FDA and basically start the IHS and New Mexico Department of Health is going to start advertising and offering the booster shots for 5 to 11. And within the next 3 weeks, we're also expecting the original series of vaccination to be approved for the 6 month to 5 year olds. So that's coming. So just keep your ears out for that. Leanna, there are quite a few fruits and even vegetables that are immune boosting. Anything that has a high percentage of vitamin C or high percentage of vitamin D can be immune boosting. Specifically, anything that is considered quote unquote citrus fruit, which also includes tomatoes.
Strawberries.
So if you go to the store regularly and you see anything that is considered a citrus fruit, like a pineapple or a mango or an orange or a lemon or a lime or a tomato or any of the tropical fruit like papaya and
Pineapple, maybe.
pineapple.
Mhm.
Those are all high vitamin C content fruits, but you also have to look at vitamin D is also considered an immune boosting mineral, vitamin. Sorry, not a mineral, a vitamin substance, and you find that in going outside. It's the primary way to get it is going outside and getting exposed to the sun and absorbing the sun because that basically is where you get is the primary source of getting vitamin D. But if you're talking about foods, you're going to look at green leafy vegetables, um, mushrooms. You're talking about beans and legumes. All of those have high percentage or high levels of vitamin D and zinc, which are all immune boosting substances. So hopefully that answers your question, Liana, because you're right. A lot of people don't nearly realize that immune boosting food consumption as well as immune boosting activities can be a protective method of for COVID, which includes physical activity. Physical activity also helps to boost your immune system as well. So if you're not exercising or you're not going outside and walking with the HHS team on Tuesday mornings, or you have not gotten the opportunity to sign up for your gym membership, please contact us so that we can get you set up because activity is a cure for a lot of things. It one of the things it cures is anxiety. The other thing it cures is depression, but it also helps to boost your immune system to keep you protected from not just COVID but any other bug that you might come across in your normal everyday life. So sorry, Rebecca, I know you were going to say something. I completely cut you off earlier.
I was going to say hydration too is so important. Oftentimes we forget to drink water. Or even, if you have a hard time drinking water, cut up a couple of strawberries or put some lemon or lime in your water. Sometimes it makes it a little more palatable. But yeah, hydration is something that we often, our bodies sometimes confuse hunger and thirst. Like sometimes when you feel hungry, you're like, I need a snack, or I need something to chew on. Ask yourself or try drinking a glass of water first and see if that helps. Because it happens all the time. We get busy, we're doing stuff, and we're like, I need a snack. And it's like, no, actually, you probably need some water. So try that out first. When you're dehydrated, one of the first symptoms is irritability. So if you get grumpy, you know you need some water.
I must need water all the time.
I know I do.
Okay. So, Liana, did you want us to repeat that back? I know you said you lost reception, but I wanted to make sure that we made sure you got that information. Oops. Let me So what happens usually is sometimes when we are in this podcast area, sometimes because we're in the same room, the echo, um, we have to mute one of the mics, and we keep forgetting to do that. So that's where the echo comes from. So we apologize. I wanted to announce that the Healthy Kids program, um, they do have the garden kits and garden boxes available for the community if you're interested. Victoria did post on social media the sign up information to the HHS Facebook and Instagram. So if you're interested in getting one of the garden kits or garden boxes and you want to sign up to get one, please contact LaDon Yazi, our public health educator, or you can contact Victoria Martinez, our Healthy Kids, Healthy Communities coordinator, and they can get you set up. I know some folks are wanting to get back into growing again, and this is a great opportunity. This is not something you ever have to pay for. It is free of charge. And we would like to get as many community members as possible on board um, to get those grow boxes and grow kits available for the garden. So, um, anybody else have anything else before we get ready to sign off? As a reminder, gym memberships are available. We have gym memberships available for the Milwaukee Wellness Center. We have gym memberships available for the Anytime Fitness in Los Alamos, and we have gym memberships available for the Anytime Fitness in Espanola. There are quite a few people that are jumping on board and getting a membership. So if you haven't done so yet, please contact us because we may run out of slots because this is a pilot program. We have a limited number of slots that we can provide for individuals at each one of the gyms. So please contact us. And we can get you signed up. That's a good question about the dog park. In fact, the recreation plan, I'm actually having a meeting this afternoon with one of the council reps to talk about the increased use of the recreation plan that was approved several years ago. And that's actually something that was on my to talk about list with the council reps to see if that's something that can be included in the design for the recreation plan, because we have a completed recreation plan. We just have to put it into practice. And so a dog park is a great idea because a lot of folks have dogs that they care a lot about and they would like to get out and not just get exercise for their dogs, but by doing so, they also get exercise for themselves, which we are looking for options and opportunities and abilities to do going forward. So, thank you for bringing that up and making and showing that that's important because I don't want to be the only lone voice talking about that because nobody else has brought up the dog park conversation. But I brought it up because I think it's important because I take my dog to the dog park and it's important that they get exercise as well, especially if you consider them part of your family. You want to get them some exercise and even socialization, right? So they can meet and talk to you and meet with other dogs, just like we are. Human beings, we need our socialization and contact and exercise. They do too. So I'll bring that up. Anybody else have anything? It is 12 o'clock on May 19th. This is usually the time that we sign off. So if no one has any questions or comments, I do want to again thank you all for joining us today. I know we had a rough start with all the technical difficulties, but sometimes it takes a little bit of time to get things up and running. And we were able to get some good information out, answer some questions for people in the community, and provide an opportunity for folks to interact with the Health and Human Services Department and provide their comments and suggestions and input, which is what we like. Whether it's negative input or positive input, any of the input that you give is something that we can use to adjust how we do things to make things better for the community. As a reminder, on June, what day is it again? The June 7th, we will be having our second in-person community health assessment event. It will be in the evening between 4 and 7. It'll be at the senior center. We will be serving food again. Anyone who is a tribal enrolled member who lives in the Pueblo is eligible to participate. If you participate, you are eligible to receive a $50 gift card. And that is an incentive to thank you for participating in our process of trying to improve services for the community. There was an issue with the last distribution around the gift cards. They didn't work. It's because they weren't activated from the bank the way they were supposed to be, but that has been resolved. So if you got a gift card, you participate in the survey, it should work now. If you would like to get your gift card and you did not get a chance to participate last Saturday on the 14th, you have another opportunity. June 7th, 4 o'clock to 7 o'clock. Be there. We'll be there and be ready to answer some questions. And that is all I have left. Tell your friends and family about the survey because that's important. We will also have on June 14th for all the men out there in the community another mental health awareness presentation for National Men's Health Month. That will also be at the Senior Center. It will be at 5:30 p.m. and we will be providing that presentation for any male in the community, whether you are a tribal member or not. If you live in the community, you can show up and listen to information and ask questions about mental health because it is an important topic and important conversation. We had the one yesterday for the women's health, the National Women's Health Week and Mental Health Awareness Month. So we'll have a second one on June 14th at 5:30 for the men. So get the word out. We'd like to have as many people show up as possible. And I know I said before that was all I had, but I just remembered those two things. So again, thank you all very much. All of you have asked questions. All of you who are going to watch this after we disconnect later on, thank you. And from Health and Human Services, we'd like to ask you all and suggest that you all get out and do something fun, get out and do something that has activity connected to it, and have a good rest of your day.